And now I want to bring in Congressman Nadler, a Democrat from New York, and Congressman Boustany, Republican from Louisiana. Good to see both of you. Good morning.
Good morning.
Congressman Nadler, let me start with you because you're a member of the House Judiciary Committee. How concerned are you about the future of the health care law?
Well, I'm concerned. You start off with a court with five very, very conservative justices, and who've shown a willingness to depart from the court's precedents in rather dramatic fashion. So I'm concerned. I agree with the professor you were just interviewing. You can't always tell much from questioning because someone can be questioning very harshly to test the mettle of the arguments. And so it remains to be seen. We really don't know at this point.
Congressman Boustany, you have kind of a unique perspective. You're a former heart surgeon, and we heard from supporters of the health care law this morning. There are protesters out again outside the Supreme Court today. One retired postal worker whose wife is in a nursing home being treated for Alzheimer's, for example. Take a listen.
Without Medicaid, there would be no way that I could pay for it. It pays for her health care and allows me to see the woman I've been married to, and it's part of me and my life for more than a half a century.
And there was a woman yesterday, it was very moving. She talked about having stage 3 breast cancer and that the law allowed her to save her house and saved her life. What do you say to people like that? If the individual mandate is struck down, are there other parts of the law, for example, that should be upheld? Give me your take on this.
Well, we do know there's a problem that existed before with pre-existing conditions, but we think there are different ways to do this that perhaps would not put as much burden on the system and create as much cost. At the same time, keep in mind that expansion of Medicaid is going to be deeply problematic because the Medicaid reimbursements are not meeting cost in many, many instances right now. And so hospitals and physicians are curtailing the number of Medicaid patients they will see. I think this is going to continue to create more problems and more backlogs in emergency rooms. I have deep concerns about that as someone who has practiced medicine and seen the entire spectrum of what happens in the healthcare system.
But of course, Senator McConnell admitted that the Republicans have no alternative whatsoever. And I find it deeply ironic that one of the plaintiffs in this case, who was a plaintiff against the individual mandate because she wouldn't need it, has now declared personal bankruptcy because of medical expenses that she couldn't meet. You know, 55% of all personal bankruptcies in this country are because of medical expenses, and 75% of the people who go bankrupt have insurance, but inadequate insurance, and that's what this bill is designed to solve, those two problems.
Yes,
but the fact of the matter is we have a cost problem, and it's not solved by this. Cost and quality have to go together, and I'm deeply concerned about the acceleration in costs that we're going to see as a result of this. The individual mandate and those who advocate by saying put everybody in will solve the cost. That's not the case in the market in Medicare, where everybody's in, yet the costs are exorbitant and rising.
Well, first of all, the cost in Medicare is going up about 1.2% a year more slowly than the cost in private care. So it isn't the Medicare problem; it's a general problem.
But it's still driving our deficit.
It is not driving our deficit. What is driving our deficit is the cost of medical care generally. Secondly, where this kind of a system was tried, where Governor Romney, who's now running away from it because of the pressures of Republican politics, tried this and put in a very similar system in Massachusetts. Costs have gone down in Massachusetts.
Costs have not gone down.
They've gone down by 40%, while they've gone up by 14% nationwide.
By all admissions, costs have gone up in Massachusetts, and that's been the problem with the program.
Costs have gone down by 40%.
But if you keep in mind what CBO has said about the Medicare program, clearly the payroll tax that we have in place is not covering the explosion in the cost of the program. This is a major driver of our federal deficits. There are things we can do that will fix the program, preserve Medicare, and protect it.
The CBO has said, the CBO, that is the Congressional Budget Office, which is nonpartisan, the CBO has said that the cost of this program, the Affordable Care Act, Obamacare, will reduce the deficit over time, and the entire cost will be about $50 billion over the 2012 to 2020 22 time period less than was forecast, in a forecast that would reduce the deficit compared to not having the bill.
Well, I have to dispute that because the Congressional Budget Office just came out with revised figures just 2 years later before even the implementation, and they're estimating the cost is going to be significantly higher.
No, they're estimating it costs $50 billion lower, and the untruth that you just heard, which has been repeated by the chairman of the Budget Committee, is that the budget is higher because they go 2 years farther out, but for the same 10-year period, it's $40 billion lower than anticipated.
Congressman Nadler, thank you.